Hello, I am Glodiana Sinanaj, lecturer at the Scientific Research Center of the Faculty of Health, Vlora, Albania. My presentation is titled Assessment of Knowledge in the Community of the City of Vlora in relation to overweight and obesity as risk factors in cancer. Definition of overweight and obesity. World Health Organization defines overweight and obesity as abnormal or excessive accumulation of fat that can harm health. Body mass index is a simple weight for height index commonly used to classify overweight and obesity in adults. Compared with people of healthy weight, those with overweight or obesity are at greater risk for many diseases, including diabetes, high blood pressure, cardiovascular disease, stroke, and at least 13 types of cancer, as well as having an elevated risk of death from all causes. Here we have the health risk of being overweight or obese, which are types 2 diabetes, high blood pressure, heart disease and stroke, high cholesterol, gallbladder disease, sleep apnea, osteoarthritis, fatty liver disease, and cancer. Despite the limitations of the study models, there is consistent evidence that higher amounts of body fat are associated with an increased risk of a number of cancers, including meningioma, cancer in the tissue covering brain and spinal cord, adenocarcinoma of the esophagus, multiple myeloma, kidneys, uterus, ovaries, thyroid, breast, liver, gallbladder, upper stomach, pancreas, colon, and rectum. Purpose of the study: assessment of knowledge in the community of the City of Vlora about overweight and obesity as risk factors in cancer. Methodology: this is a cross-sectional descriptive and analytic study conducted with 475 citizens in the community of Vlora, to whom the questionnaire was distributed from January 10 to June 13, 2021. They had different socioeconomic and educational levels. Informed consent was obtained at the time of data collection, and confidentiality and anonymity were ensured. The counting was done with a statistical program SPSS number 17 and Excel, taking the information presented in tables and graphs. Results. The first graph shows age of the study population. It is noticed that the largest part of the population, with 50.9%, are under 30 years old. 18.9% of the study population are aged 13 till 40 years. 16.2% of the study population are aged 41 till 50 years. We have the graph below of gender of the study population. It is noticed that 59.2% of the study population are female and 14.8% of the study population are male. Here we have the graph number 3, the educational level of the study population. It is noticed that 44% of the study population have a secondary level of education. 35.9% of the study population have a university level, and 20.1% of the study population have a postgraduate master level. The graph number 4 shows the evidence of how the population survey defined obesity. 12.4% of the study population defined obesity as weight gain. 18.6% of the study population defined obesity as overweight. 16.9% of the study population surveyed defined obesity as the disease of the century. 19% of the study population defined obesity when BMI is higher than 30. 10.5% of the study population defined obesity as the deposition of large masses of fat in the body. 15.8% of the study population defined obesity as a source of other diseases. And 6.8% of the study population do not know how to define obesity. The graph number 5 shows the evidence in which category of BMI our population included in the study belongs. It is noticed that 15.9% of the study population have a normal weight. 14.4% of the study population are overweight, and 8.6% of the study population are obese. Here we have the graph number 6. Identify whether being obese or overweight is associated with an increased risk of cancer. It is noticed that 68.2% of the study population report that being obese or overweight increases the risk of cancer. 10.9% of the study population report that being obese or overweight does not increase the risk of cancer. And 20.8% of the population surveyed report that they do not know if being obese or overweight increases the increased risk of cancer. Ongoing, we have the graph number 7, possible reasons that obesity is associated with cancer. It is noticed that 21.7% of the study population report that one possible cause associated with cancer is increased insulin levels and insulin growth factor 1. 21.5% of the study population report that one possible reason that is associated with cancer is chronic, low-grade inflammation, which is more common in people who are obese. And 26.5% of the study population report that one possible reason that is associated with cancer is higher levels of estrogen produced by adipose tissue may promote the development of some cancers, such as breast and endometrial cancers. Results. The largest part of the population, with 50.9%, are under 30 years old. It is noticed that the largest part, with 59.2% of the population taken in the study, are female. The vast majority, with 44% of the study population, have a secondary level of education. 90% of the study population define obesity when BMI is higher than 30. 41.1% of the population taken in the study report that what is correct about obesity is that obesity is defined as an excess percentage of total body fat. 15.9% of the study population have a normal weight. 36% of the study population cite reduced mobility and physical activity as the leading cause of obesity. 30.3% of the population taken in the study report that one possible reason that is associated with cancer are fat cells, can also affect processes that regulate the growth of cancer cells. 18.3% of the study population reports that breast cancer is associated with overweight or obesity. conclusions, individual responsibility can have its full effect only when people have access to a healthy lifestyle. A good health is the best wealth. Take care of yourself. Healthy living from the inside out. Thank you.